Victoria reported 1,419 new infections today, which was a jump, but not unusual for a Thursday, as interactions from last weekend trickle into the tally. When you step back, the 7-day average has been fairly steady in the past few weeks and now sits just above 1,100. The figures put the state on the lower end of the Burnet Institute's modelling, which underpinned the path out of lockdown. Victoria is still recording much higher daily cases than New South Wales, where the 7-day average sits a bit above 200. But those watching the figures closely say that has a lot to do with how the two states were placed as they left their separate lockdowns.
We reopened at a much higher number of cases, and New South Wales, when they reopened, they were at a lower number of cases. So, from the peak, we've about halved, and New South Wales is about the same.
In an encouraging sign, hospitalisations have remained at around their lowest level in more than 2 months, with 288 COVID patients in the system.
Well, case numbers are less relevant today than they've ever been. Of course, there is a conversion of total cases to total hospital admissions, but the trend, we're seeing less and less people in hospital.
And while the pace has slowed, the state's vaccination rate is still rising, with 91.1% of Victorians aged over 12 now protected by 2 doses of a COVID-19 vaccine.